Welcome back to 1011 News at Noon. Joining us now is retired family physician, Dr. Dale Michaels. Doctor, thank you very much for being here.
Good to be here.
Yeah, today we're talking about the month of October being Health Literacy Month. So we want to know, what does that mean?
Well, health literacy means that we doctors can manage to confuse most of our patients with lots of fancy language. And so patients need to be aggressive in a nice way and try to learn what the doctor's saying and get interpretation to words that mean anything. You know, doctors, even talking doctor to doctor, if they're in different specialties, sometimes don't understand what the other one's necessarily talking about.
Right.
Well, that's especially true as patients. So if you're going to go to the office and you're a little older or maybe a little forgetful, take someone with you. That's part of health literacy. Make sure that you have somebody there who can listen. Don't hesitate to grab a little notepad so you can write things down. If you have questions for your doctor, it's easier to put them down in advance so you can ask the question rather than saying, well, I remember there's something I wanted to ask you, but I don't know what it was. So it's those kinds of things and doing that. It's also very true, Megan, in the hospital, because in the hospital there's so many things going on and you don't know what's all happening. And getting someone with you or getting someone to write down so you can ask the nurses. The doctor may be too busy, but you can ask the nurses, what does that mean? Can you explain it to me? Yeah. Can you draw me a picture on a whiteboard? Whatever it might be, so that people begin to understand, because after all, it's your health. Right. So it's important for you to know. And as you say, sometimes you need to go with a family member because well, who cares, you know? Or I think he said that. Well, that doesn't make any sense. Well, maybe that's not what he said. And so it's those kinds of things, learning, listening, bringing someone with you, writing things down, asking your questions, and don't necessarily expect the doctor to provide answers to all 15 things you brought with you. Maybe it's good to only get 2 or 3 explained well. So kind of prioritize. Think about the most important things for you to do or what you want to know. You know, with little kids, you want to know certain things. Well, make sure you have it written down so you can ask.
Yeah, and I think it's really important for people, too, to not be embarrassed when you have a question. You know, the doctors are the specialists. You know, they know all about it. They're willing to answer the questions when someone doesn't have that knowledge.
Yeah, I think it's really important for people to recognize that, you know, you need to ask the question. And if the doctor can't answer it, maybe the nurse can or somebody else. But get the question, and if the doctor, and I have been there, done that, make sure that if the doctor says something you don't understand, say, I'm not sure I understand what you mean. Can you explain that a little further?
Absolutely. Well, Dr. Michaels, thank you very much for explaining what Health Literacy Month means for us.
Good to be here.
Thank you. And we'll be right back with another check of Brad's forecast after the break.